Hello, my name is Michelle Stuercke, and I am the Chief Clinical Officer for Transitional Care Management. And I'm here today to talk to you about one of our favorite topics, COVID-19. Before we get started, I just want to say thank you to each and every one of you for all that you have done over the past 2 years. It's hard to believe that we're starting our 2-year anniversary of COVID. And again, want to thank you for everything that you've done. All the hard work that everyone's done out in the healthcare community does not go unnoticed. So one of the things as we're moving forward with COVID-19 and working on the next steps, we still have questions about why should I get a booster? Why should I get vaccinated? People who got vaccinated still got COVID. So what does that mean? And I think we need to look at some very poignant statistics that are out there. My area of specialty is long-term care, so some of these statistics will come from long-term care, but also many of them also come from the community. So we know that in long-term care, unvaccinated staff are responsible for 88% of the COVID-19 cases among staff. That's a huge amount. And when you think about 88% of the staff who's unvaccinated getting COVID and being out of the communities, we know that that can further exacerbate a staffing problem that may be occurring at the community. We know that 11% are vaccinated and not boosted, and only 2% of staff in long-term care who get COVID-19 at this point are vaccinated and boosted. Unvaccinated residents continue to make up 90% of the COVID-19 cases among long-term care residents. Again, a huge amount. 7% are vaccinated and not boosted, and 3% are boosted. So again, we can see that boosters do affect the amount of people in long-term care with COVID-19. And it is effective in protecting this vulnerable population. The other thing that's important to look at is deaths. If we look at deaths of long-term care residents, only 1% of those individuals who die are boosted. 8% are vaccinated and not boosted, which means 91 of the deaths that are still occurring in long-term care are occurring among unvaccinated, unboosted individuals. When we look at the hospital community, we see that 93% of the individuals in the hospitals are unvaccinated. 7% are vaccinated and 1% are vaccinated and boosted. So I think what these statistics are showing us is that even though you may get COVID-19 if you are vaccinated and boosted, we can see from these statistics that your chances of being in the hospital and your chances of death occurring from COVID are very, very low. And at the end of the day, isn't that the point, right? So when we look at what vaccinated means, it's important to realize the starting point. When we look at the COVID and the Moderna vaccine, we know that you are considered fully vaccinated 2 weeks after the second dose of the Pfizer or Moderna vaccine, or one dose of the Johnson & Johnson and Janssen vaccine. If you are not fully vaccinated, you cannot be considered up to date. However, once you are fully vaccinated, you are considered up to date until you are eligible for the booster. And then once you've been boosted, you're considered up to date. And that came directly from Dr. Stuercke at the CDC. So when can you get your booster? 5 months after the second dose of your Moderna or Pfizer vaccine, or 2 months after your dose of Johnson & Johnson or the Janssen vaccine. And the exciting thing about being boosted is once you're boosted, you're considered fully vaccinated, as opposed to when we got our vaccinations, the first 2 or the first 1 of vaccinations, we had to wait that 2 weeks to be considered fully vaccinated. Now, once you're boosted, you're considered fully vaccinated. So as we look at lifting some of those measures in healthcare, we realize that some of the things that we have to look at are vaccination rates and vaccination effectiveness. And again, when we look at the statistics that we talked about prior, we know that vaccinations are effective for keeping people from dying and out of the hospital. And then with that, we'll also look at community transmission rates and as well as how individuals in the community and the hospitals are doing with their bed overload. So in conclusion, I just want to say it's really, really important as we continue 2 years later to fight this COVID-19 pandemic that people consider getting vaccinated. Obviously, everybody's situation is different, so you want to talk to your healthcare provider, but we know statistically that the boosters do work in preventing hospitalizations and deaths. So please continue to fight the good fight, and thank you for joining us today.